Hello there again, student nurses. For today's episode, our spotlight would be on anti-emetics and anti-motion sickness drugs, Buclizine and Cyclizine. These are antihistamine and anticholinergic drugs used as anti-emetic and anti-motion sickness. Before we start digging into each of these drugs, let's discuss first their mechanisms of action. Since they are antihistamines and anticholinergics, they block histamine and muscarinic receptors in the synapses that transmits impulses from vestibular apparatus to the chemoreceptor trigger zone, which controls vomiting, hence reducing this pathway's activity. Now, let's start for Buclizine. It has a brand name of Buclidine, Buclidine S, and Lungifine syrup. This is indicated to control nausea, vomiting, and dizziness of motion sickness, treatment of migraine attacks, and to nausea and vomiting during pregnancy. It is rapidly absorbed from GI tissues, crossing the placenta and enters breast milk, metabolized in the liver, and is excreted in the urine. Now, student nurses, to ensure patient safety, here are the must-to-know informations of Buclizine. It is contraindicated to patients' allergy to Buclizine and tartrazine, common in patients who are allergic to aspirin. It is used in caution during pregnancy and lactation and to patients with narrowed angle glaucoma, stenosing peptic ulcer, symptomatic prostatic hypertrophy, bronchial asthma, bladder neck obstruction, pyloroduodenal obstruction, and cardiac arrhythmias, or those conditions that may be aggravated by anticholinergic therapy. Now, for its common side effects, it includes drowsiness, dry mouth, headache, and jitteriness.
And now, let's move on to Cyclizine with the brand names Amokil, Marizine, Marzine, and Valoid. It is indicated for the prevention and treatment of nausea, vomiting, dizziness associated with motion sickness, and control of post-operative and drug-induced vomiting. It is rapidly absorbed from the GI tissues, crosses placenta and enters breast milk, metabolized in the liver, and its excretion is unknown. To ensure patient safety, here are the must-to-know information. Cyclizine is contraindicated to patients who are allergic to cyclizine. It is used cautiously during pregnancy and lactation and to patients with narrow-angle glaucoma, stenosing peptic ulcer, symptomatic prostatic hypertrophy, bronchial asthma, bladder neck obstruction, pyloroduodenal obstruction, cardiac arrhythmias, and post-operative patient. For the common side effects in the CNS, we have drowsiness, confusion, euphoria, nervousness, restlessness, insomnia and excitement, seizures, vertigo, tinnitus, blurred vision, diplopia, auditory and visual hallucinations. In the CV, we have hypotension, palpitations, and tachycardia, dermatologic or urticarian drug rush. In the GI are dry mouth, anorexia, nausea, vomiting, diarrhea or constipation, and cholestatic jaundice. In the GU, we have urinary frequency, difficult urination, and urinary retention. And lastly, in the respiratory, we have respiratory repression and dry nose and throat. And lastly, the nursing responsibilities before, during, and after administration of Buclizine and Cyclizine. Before administration, 3 important things for the nurse to do are history taking, physical assessment, and patient teaching. First is to conduct history assessment of allergy to the drugs, pregnancy and lactation, and presence of the diseases in the causal list. And the next is to conduct a physical assessment to gather baseline data. And lastly, conduct patient teaching on the following. Take the drug before motion sickness occur or before traveling. Avoid drinking alcohol because it could lead to a serious sedation. The medicine could also be taken without water and be placed in the mouth and let it dissolve. It can also be chewed or swallowed whole. And also lastly, teach patients of the common side effects of the drugs. During administration, prepare analgesics in case it is needed to relieve headache. And after administration, monitor the patient for side effects. And that's it for Buclizine and Cyclizine. We hope you learned something. See you in our next episodes. Bye!